thank you so much for taking the time to join me from the other side of the world. You're in Germany, I believe. And so you are at the forefront, a pioneer in some really interesting ways of approaching cancer. And I wanted to just visit with you and learn more about your work. And I think it's a really incredible story. So thank you for taking the time to jump on here.
Okay, thank you for inviting me.
So, can you go into just a little bit of your background? You have been a doctor for a long time, but I think that if you can just lay out just briefly what your experience is in medicine, that'll help the listener know that I think we can listen to you.
Yeah, originally I come from the natural science. So in my first study, I made a diploma in chemistry and biochemistry. Studied 6 years on the university, and after this, I decided to make another study in medicine. So, and then I had a very good education in the university. So I spent 15 years studying and working on the universities. And I think I had a very good background because I'm coming more from science, And around 1988, then I started my own private clinic. No, it was first a public clinic. And I worked in public medicine and internal medicine for about 30 years already, treating thousands and hundreds of thousands of patients. And, when you are working long time on your patients, mostly old patients, chronic sick patients, cancer patients, you start to recognize the limitation of our medicine today. And when we speak about cancer a little bit more today, of course, we know the traditional ways like surgery, radiotherapy, chemotherapy. I have done everything many times on my patients. But anyway, earlier or later, you recognize the limitation and then you start looking maybe for different ways. I'm not the one who only work with supplements or something. I'm coming more from science. And another way, what has really a good scientific background in cancer therapy is so-called photodynamic therapy. And this is something what I have invented. A lot of famous universities worldwide looking for other ways for cancer, especially photodynamic therapy is regarded as the best way for treating cancer because it can kill cancer cells, and in the same step, and that's the difference to chemotherapy, it improves your immune system. And that's fantastic. But on the other hand, there are thousands of publications about this, but everywhere you can read about the limitations when you have to use different light-sensitive substances, you have to use different lasers of different wavelength. So not everything is available. And that's the problem on the field on which we are working now for more than 15 years already.
Dr. Weber, what I find so fascinating about your approach is it's almost like taking the natural world and utilizing some of those pieces in a more scientific approach. And so to me, you seem to follow a lot more of like the AMO physics in your treatment. It's not the biology first. It's looking, atomic, molecular, optical physics of how things are working. I think that is so fascinating, and which makes me it makes me question some of the stuff that we're told about we need to hide from the sun, that the sun's killing us. If you're taking these isolated aspects of what the sun provides and using it in a therapeutic manner, where do you think we have gotten so far off from the approach that we're currently using to attack chronic disease?
Now, yeah, first of all, it's right what you said. The light is so interesting, Today, many people and many research work on so-called phototherapy. They use light to regenerate the body, to improve body function, to give energy to the body. The so-called biomodulation. We call it photobiomodulation because it can stimulate mitochondria and all the metabolic pathways. That's so-called phototherapy. But this is not the way where we treat cancer. Phototherapy is something where we give energy to enhance the energy level, the immune system, and everything, you know. We speak about today about photodynamic therapy. There's a big difference, you know. Phototherapy improves everything, but photodynamic says it kills something, you know, but not the good cells in the body, the bad cells of the body. So we have to distinguish. And for photodynamic therapy, first of all, we need a so-called photosensitizer. These are substances mostly derived from natural things like chlorophyll or curcumin and something else, you know. So we need natural things, what we can give to the body as a cream or as an infusion, which specifically can bind to malignant cells. And when they bind to malignant cells, they build a complex. And, you know, the photoactive substances, they have a specific absorption spectrum from the sunlight, you know. And, you know, from the sunlight, we have ultraviolet, we have blue, green, red, yellow, and near infrared. And they absorb something of the sunlight. So bring this sensor on the higher level, then the energy is transferred to tissue oxygen, and tissue oxygen will become into radicals which kill cancer cells. That's the principle of photodynamic therapy. So you see, that's so wonderful. We can use light in different ways. You know, we can enhance body function, and we can use it specifically to eliminate malignant cells or even viruses or other kind of microbes, what we call it antimicrobial photodynamic therapy. And, you know, in many patients, they're also combined with virus diseases, chronic diseases, which also might be a reason for the development of cancer. And, you know, what is so fascinating in this field, if you look at our body, you know, if you look anyway, on the whole nature, everything is developed in million years in the sunlight. And everything what is in our body, in our cells, everything is made from sunlight and absorbs something from sunlight. And that's the reason when we know a little bit more specifically the different enzymes and many things in the body, we know today with which kind of sunlight we can stimulate them, yeah, and that makes it so fascinating. So what you said is right. It's a combination of nature, biology, light, and I think, and many researchers agree that this is the best way of treating cancer with natural things. The only thing, we have to find the right photosensitizers, we have to develop the right lasers, and that's what we did. We invented machines with all spectral colors, and what is more important, not only shine the light on the body because the light cannot penetrate deeply. We have developed a technology with so-called interstitial laser therapy, so we can bring sterile fiber optic fibers into cancer or close to the cancer inside the body using endoscopes. So that's what we have developed and also used in our patients now for more than 12 years.
So can you go into some of the results that you're getting and kind of timeframes with the laser therapies and the photosensitizers? And is this something that is readily available in the United States? Because it's not something that I have seen have a lot of access to.
It is available in the United States. If we look in historically, we developed the first machines with so-called model machines with all the different lasers already in 2004, and got them approved in Europe by CE in 2005 already. And I always had a dream to bring this to America, you know. And then I started working on FDA approval in 2006 already. And I will never forget when I got message, a letter from the US FDA that they approved our system, you know. So the device is available in the US already, and we have a lot of clinics and amazing colleagues working already together with us, making research, exchanging experience. And since about 7 years, we organize an annual big scientific conference, mostly in San Diego, but we also were in different other places. And last time we had, I think, about 300 medical doctors. These are always huge events, and the next one will take place in March, in about 4 months, in San Diego again, and the second one in Miami. So the
Awesome.
machines are available, and I have very good clinics on my side who are working with us together.
Okay. And that's Weber Medical. You have a lot of different devices. I think that it is so cool. But before we get into a little more of your devices, I would like to get your thoughts on something I think a lot of people have at least been familiar with in methylene blue. Do you utilize methylene blue in some of your therapies, or what are your thoughts on methylene blue? Because I feel like that is kind of that gateway into understanding light is based off some of these colors.
Yeah. Yeah, let us speak about methylene blue and maybe some different natural photosensitizer. Methylene blue is something what I like very much. It's a wonderful photosensitizer. It is long time on the market. We know it has very low side effects, and methylene blue is something what is also not so expensive. No? Many photos are quite expensive, and I like to use methylene blue. You can put it on the surface, for example, if there is some skin cancer or maybe basal cell carcinomas, keratosis, something. But I use it also intravenously, and I also inject methylene blue directly around or into tumors and work for 2 or 3 hours, and then I start the therapy. And we know exactly the absorption spectrum. Methylene blue works exactly with 658 nanometers red light. And this is easy available. You can use it from outside, if it's more superficial. But I told you already that we have fiber optic needles, what we can put maybe ultrasound guided deeper into the body to bring this red light for stimulation of the methylene blue. Methylene blue is a wonderful substance. I like it. But if you look, there are some other very nice natural substances. One of them is curcumin. Many people take curcuma, as a supplement for inflammation and prevention also of cancer. And curcumin also is available as capsules or as infusion, and curcumin can be stimulated exactly with 447 nanometers blue light. Another one is riboflavin, vitamin B2, is available as capsules, very cheap one. We also have infusions, and this works with ultraviolet 375 and the same like curcumin with 447 blue light, and it kills nearly all the viruses in the blood. We made wonderful studies with COVID and everything. It's a wonderful medicine. There is hypericin from the St. John's wort plant. It's a red fluid, and this absorbs exactly yellow light, 589 nanometers. And today mostly we use indocyanine green, which is long time on the market, which is a green substance, and this works with near infrared light. You see, and that's exactly the reason that we need machines with all the different lasers inside. So now we have a modular system where you can put up to 16 different lasers on one machine, and then we can use all the different natural substances to stimulate them in the body.
How cool is that? Do you have any experience with berberine? That seems to be a really popular supplement that goes along with, I've seen on the list that you're using. I know you're using it different, but is berberine something that's in your toolbox?
Is also well known. It works. You can stimulate only with ultraviolet light, but we have since 2 or 3 years we have also ultraviolet lasers, which were so expensive years ago, and also in our system. So most of the, most of the substances who have a color, green like like chlorophyll, or yellow like curcumin, they absorb something of the visible spectrum, and then the clear substances which don't have a color, they mostly absorb in the ultraviolet spectrum.
So you bring in ultraviolet, and I think that is a topic that scares a lot of people. A lot of people are scared that you go out in the sun, you're going to get cancer, you're going to get skin cancers and cause melanoma, and do all these other things. So do one aspect of that I really think that we've missed the boat on is that's never isolated in the sun, right? Like by the sun, it's 50% infrared at a minimum. And so it's not in isolation that a lot of these studies come from. But I definitely want your take on that, because to me, the whole vitamin D conversation is directly related to UVB, and as well as melanin. And I think that is something that we are understanding more as we get into that physics side of how the human body works. That melanin is extremely important. Vitamin D does some really cool things with light and energy. So what are your thoughts on that sun versus the isolated UVB? And then if you have anything to go along with the melanin.
Now, when we speak about ultraviolet, first of all, we have to consider that ultraviolet is not one wavelength. Ultraviolet is a big range of wavelength, and in general, the shorter the wavelength is, the more energy this light have. And for ultraviolet, we have to distinguish between ultraviolet C, which is very powerful with very short wavelengths. Fortunately, it's kept in the upper atmosphere mostly by ozone and will not come to the world because it's very dangerous. When you go to a little bit higher wavelength, about 300, 250, is ultraviolet B. Ultraviolet B, or UVB, is the one who makes us stimulates the melanin that we get brown color, but it also, with too much exposure, it can cause cancer. So that's ultraviolet B. But when you go more than 320, 320 and 400, you have ultraviolet A. And ultraviolet A is absolutely harmless. And with this laser, we can stimulate all the different substances. And it's a wonderful light for the body. It can clean the blood from microbes, especially when you use vitamin B2, riboflavin, which will absorb 275 ultraviolet light. So that's something what we have to a little distinguish. No? It's not only one ultraviolet.
Yeah, that's awesome. So I saw on one of your videos with a patient using post-chemo treatment, a helmet, or utilizing some infrared light. Do you care to go into what the light does after kind of your more traditional treatments?
So you speak about brain cancer, maybe, yeah, right?
It was in the video I'm talking about. The lady had just received chemo, and then y'all were doing some red light after the chemotherapy.
Yeah. First of all, when we speak about this helmet, that's something, helmet which is equipped mostly with some 100 diodes of near-infrared light, because only near-infrared with a wavelength around 800 is able to penetrate the skull bone and goes into the brain some centimeters. Red light or blue or yellow with shorter wavelengths are not able to penetrate bone tissue. So you can only use normally near infrared light. So first of all, we use helmets in phototherapy for regeneration to stimulate maybe cell growth and improve microcirculation, stimulate the mitochondria of the neurons in degenerative diseases, neurodegenerative diseases like dementia, Alzheimer, Parkinson, post-stroke patients. When you speak about post-chemo, then we have to speak about cancer, maybe brain cancer. We're treating a lot of them. And the problem was up to maybe 2 or 3 years ago that we were not able to treat any brain cancer successfully with photodynamic therapy. Because we did not have the right photosensitizers, which can be stimulated by infrared light. And today we have a formulation, made from one university in Germany, the so-called indocyanine green. It's a green substance, and that's the only one on the world market which absorbs near infrared light, and near infrared can penetrate the brain. So with this one, we can treat successfully brain cancer. Maybe after photodynamic therapy or even after chemotherapy for brain cancer, then the patients use a helmet to continue their therapy at home. So always to distinguish phototherapy, every degeneration in the brain with a helmet, or post-chemo, post-photodynamic therapy for maybe destruction of the rest of tumor cells in the brain. So that's two different ways.
Yeah. Too cool. I think it's absolutely so fascinating, and it just seems so different than the traditional approach. A lot of times it's just hard to wrap your mind around, but it is fascinating, and you're getting results. I think that is what is the most exciting thing, is you're getting results without these just awful side effects. So for me, my introduction into the cancer was when my 5-year-old, he's now 10, was diagnosed with stage 4 cancer. And so you see the surgery, the radiation, the chemotherapy, and all the effects that go along with that. I did not know, Dr. Weber, this even existed. I didn't know that this was even an option that was possible. So what do you think that we can do to help create that awareness and have access to the possibilities of the treatment you've really have been pioneering for years? How do we get more people aware of this, do you think, or have access to it?
One of the access what we are doing today, that we are discussing this, and maybe people can watch what we are discussing here. And other ways is, of course, that we are organize all the time conferences, we're making podcasts and with other groups, and but it's not such easy, because in treatment of cancer, there's a lot of different groups who want to participate financially on this. Now, I will not speak about chemotherapy, but there's a lot of financial interest in all these things, and when you come up with a different way, what we is maybe even cheaper for patients, we have not, I don't want to fight, with big groups of the pharmaceutical industry. Anyway, I will not say that chemotherapy is not working. In some cases, really, it's working and it's helpful, And sometimes when tumors are very big or so, then we have problems with photodynamic therapy. So then it might be good to let it shrink a little bit, and make the chemo first. And but anyway, we know curing with cancer chemotherapy is less than 5% at the end, no? But in some cases, it's helpful, of course. But yeah, the PDT is something, it's not such easy to spread it in the community. Of course, we have more and more doctors, and, we're treating many patients, and patients, they are satisfied. They know a lot of other cancer patients. So it will spread mouth by mouth inside the patient's community. Other doctors, we have a lot of doctors coming for training and everything. They spread it to other doctors and other groups, but it's a long way, It's not something what can go on in 1-2 years, no?
Yeah, no, absolutely. We got a lot of work to do. So I want to ask you something, and feel free to just say pass, skip. I get it, but it seems to me that over the last few years, cancer has changed in some ways. There's been some things that popped up, and with that, the viral side of cancer seems, with some cancers, let me rephrase that. The viral side of being a cause of cancers is really, I mean, it's there. So specifically on that one is the SV40, and so the simian virus 40 is really keeps popping up as being something that we need to deal with. I can't find a really good solution, and I think this is why I would love your take, but I get it if you want to just pass. If SV40 is the oncovirus that is at the root cause of some cancers, and there's nothing we can really do about it that I've been able to find yet, is potentially the light therapy a solution for the SV40 issue?
Yeah, I think it is. Anyway, when we speak about oncological viruses or maybe other ways of immunotherapy, that is something what is very new, what we are doing today. We combine our photodynamic therapy mostly with a low-dose immunotherapy. Yeah, so a lot of things besides oncological viruses. There's a lot of different antibodies, inhibitors of growth factors, and every month there are new substances on the market. But we have seen, when when you look on a cancer, and you make a photodynamic therapy, you give the photosensitizer, it will bind to cancer cells, maybe not to all, but maybe to a part, and then with the right light, with the right energy, you will destroy some cells, and the broken material of those cells, they work like antigens, They will be taken up by dendritic cells, they're transferred to T cells, activate the T cells. That's a so-called adaptive immune effect, and the T cells attack the rest of the cancer. The problem is cancers can hide, for the immune system, because they have different kinds of receptors which prevents that T cells can attack them. And what we are doing today, we give, we call them also checkpoints, we give a low dose of so-called checkpoint inhibitors. They block this receptor, so the activated T cells can better attack and destroy the rest of the cancer. And the good thing is, and we call this abscopal effect, in this process, also metastasis as well, wherever they are in the body, can be attacked in the same way. That's combining. That's the newest what we are doing today, combining photodynamic therapy with low-dose immunotherapy. And it's a lot of research done in the last 2 or 3 years, and that's what we are doing also our patients with much better success than before.
I love that. So what are your philosophies or protocols with like detox as the cancer cells are dying and the part of the lysis and the die off happens? What do we do to help mitigate some of those downsides?
Now, when we are treating patients, normally they come for 1 or 2 weeks, and we are doing this photodynamic therapy, but we always combine with so-called intravenous laser therapy, which first in one step stimulate the immune cells, the different white blood cells, but also improve especially blue laser microcirculation. It stimulates kidney and liver function, so you have a better detoxification by this. We have more and more clinics, they're also combining with plasmapheresis machines, They take the blood out, let it run through a machine, and now they use it in combination with our laser to get better results. So this is, of course, a little bit more expensive procedure, but, take out the blood completely, like a dialysis, and run it through a special filter system, can add oxygen and everything. That's, I think, the best way of detoxification. But anyway, intravenous laser, what we give for an hour every day, has a wonderful effect on detoxification. And the good thing is, photodynamic therapy is a slow reaction therapy. So it's not that immediately all cancer cells are destroyed and overwhelmed with broken material, and maybe get allergic reaction like so-called Herxheimer reaction. So the process works for 3, 4, 5 weeks, and that's we never have seen any or any problems with too much broken cancer cells. The body has time to remove everything step by step.
That's so promising. And I have read different times that there were efficacy around like Lyme and some of these really harmful issues that are really hard to treat. So what is that something that we have hope that this can be a solution for so many things even outside of cancer?
You mean something, what you speak about Lyme disease, did I understand you correct?
Yes.
I told you already, one field of photodynamic therapy is photodynamic cancer therapy. But photodynamic therapy can do more, and we call it antimicrobial therapy. So we also can work in a wonderful way to kill all the microbes. And I said already that a lot of cancers have a reason, in chronic viral infections. Now look at HPV or so in cervical cancer. Today we have a vaccine already, but we know that a lot of chronic infections, Epstein-Barr, or there's many different ones, that they can contribute to the development of cancer. No? We know anyway, chronic infections can be enhance cancer growth, of course. And we know everybody gets cancer from time to time, you, me, everybody. But if the body has a strong immune system and has not to fight against other things, then we can repair everything what is damaged by cancer and the body stays healthy. But anyway, the antimicrobial effect is amazing. And so first of all, we can treat successfully these chronic infections. My son, Robert, they just made a study on malaria in Nigeria, and with one treatment with vitamin B2, riboflavin, and blue laser, they could cure 90% in one session. So this was just published, this study. But Lyme disease is a big issue in America, I know. But Lyme disease also can treat wonderful with photodynamic therapy using, I would suggest, curcumin and riboflavin in combination with blue laser and ultraviolet laser. So this is a wonderful way to cure the body from these chronic infections. And 2 years ago, I have published in America COVID studies. What I made myself with a group of COVID patients, and use riboflavin, B2 as photosensitizers in combination with blue and ultraviolet light, and with amazing success. Anyway, in America, in the big hospitals where they keep the blood bags, they add a little bit of riboflavin and put it in a machine, which is in the US on the market, with a little bit of light for 5 minutes, and then all virus killed immediately. So we know this. But it was never applied on humans, and that's what we did in this COVID time. And the antimicrobial effect is amazing. And besides cancer, we know that a lot of people dying from chronic infection, resistant Staphylococcus, there's so many different things.
Why do you think you're able to piece some of these things together that we're just seem to be missing. Why are you able to see some of these connections in a really unique way?
Yeah, you know, I have the big advantage myself. Um, First of all, I have a good scientific background, and we did not only invent a machine and try to sell it, you know, and make money of this. No, I come more from the clinical way, you know. First of all, I worked for 30 years on patients, you know, and get a lot of clinical experience. And then, fortunately, 20 years ago, I met a famous professor of physics. We came together, and then we had the idea to use lasers in the beginning to stimulate acupuncture points. But later we have seen the great potential about this. And you know, with this long years clinical experience, it was easier to me to use it on patients. Everything what we have developed in the last 20 years, we developed this on our patients. We got experience. We have seen results working or not working, not running in the wrong direction. You know, that's the big advantage what I have, you know, or what we have here.
How important is that crossover? Because you mentioned the physics with the medicine. How important do you feel like going forward having multidisciplinary collaboration will be to really getting some more solutions out there?
Yes, that's exactly the point, no? So we can do many things, but we cannot do everything, no? And that's why I always try to get a lot of different good universities or research groups on our side. And in the beginning, I could work with Mayo Clinic in Jacksonville in Florida, and we made acupuncture studies, and it could be shown and was published from Mayo Clinic in America that the acupuncture effect using very well focused lasers on acupuncture points was 2 times better than the Chinese medicine. You know? That was the big, and that. And later, you know, we now have a very good copy with different pharmaceutical departments, because I told you the main problem is that we did not have all the effective photosensitizers. Of course, chlorophyll, methylene blue are wonderful things. For example, we could never treat brain tumors successfully or bone metastasis. And so the university there, the pharmaceutical people, developed inosine green, you know, and they put it in so-called nanoparticles because the pure substance is not working. It's 30 minutes out of the body. They put it in special nanoparticles so that it stays long time in the circulation and then step by step can accumulate in the tumor. Because when it's not accumulating in the tumor, it will not work when you give the right light. So you need the physical people, the pharmaceutical people, the good clinical people. You have to put them all together. And that's a the big advantage what I have. So in all these 20 years, I try to bring all these people together. And 2008, I have set up a scientific organization. We call it ISLA, International Society of Medical Laser Applications, and an international one. And so we have some thousand members already all over the world. And, you know, every year we make the big conference in America, in summer in Germany, and in autumn in Asia. You know, in the last 10 years, I also had a clinic in Bangkok. And every month, 2 weeks in Bangkok, jumping in the airplane for 12 hours, and then 2 weeks in Germany. Time, and time when I came, I had 20 doctors from Indonesia, from Taiwan, from China, from Japan, or so. Also, we have opened up this Asian field, you know, and especially in Asia, they're very open-minded to this field. It's easier than in America, you know, what is, of course, more traditional, you know, but that's the way to bring everything together, the different specialists, and bring them all in one group. And we are still working on this.
Well, I am so excited for the future. I cannot thank you enough for the work you've done and taking the time to visit and share your story with us. And we'll get this out and make sure that people at least know this is an option. And we'll link back to your website and everything you're doing. So again, Dr. Weber, thank you so much.
It was my great pleasure. Thank you. Okay.
Thank you for joining us in the Sowing Prosperity mission. If you like this content, like and subscribe, share with your friends. Be sure to check out sowingprosperity.com. Sign up for the email. We've got so much more work to do.